Hi guys, 𝗬𝗲𝗃𝗁𝗏 so awesome here. I think I should probably take the time to explain to you guys the purpose of social distancing. You guys know all this stuff going on with coronavirus, aka COVID-19. It's a lot of stuff going on. A lot of different cities have put their the mayors have put their cities on lockdown, so you really shouldn't be going out unless it's like an absolute emergency. But I think that for some people, they don't know how serious it is, okay? So I'm obligated, because I'm a nurse, to take care of all patients, right? Specifically, when I work at 𝗏𝗏𝗏 Hospital, I am designated to the COVID unit, so all the patients I take care of there are either COVID positive, certainly COVID positive, or they are rule outs, which means they have the symptoms, but we have not gotten back the test yet to make sure they are COVID positive. And I want to tell you guys, it is not a game. They come in, they're talking on Monday, they have some respiratory distress on Tuesdays, meaning something like some shortness of breath, which means we have to give them like supplemental oxygen via like a nasal cannula or something like that. And then later on that day, you guys, a lot of these patients are getting intubated. That means they need respiratory support. This is serious. This is not anything to play with. Serious, guys. And I want you guys to know that even though we have dealt with different type of coronaviruses before, like the flu is a type of coronavirus and stuff like that, this is one that we've never dealt with before. So understand that everything that we are doing for these patients are trials, right? We really don't know what to do, right? We're taking past research from other viruses that appear to be appear to be like the COVID-19, right? And we kind of use those viruses to learn how to treat this virus, but it's like a trial and error thing, you guys. We don't know what we're doing. We're still trying to figure it out. Hence why they have us social distance and keep to our own houses and stay out of the public, so we can get a cap on these things, right? I'm a nurse. I'm obligated to get out in these streets and do what I have to do to take care of the patients. But if you guys are don't have a job that makes you come out of the house, you guys need to stay home, period. Like, I am somebody that loves to work out. I have learned to work out at home, and I hate working out at home. I totally need the motivation of the gym and other people to motivate me. And I want you guys to know that I have even learned how to work out at home. My poor child has been in the house all of this COVID-19 breakout, on top of the fact that he has distance learning for school. Like, he has cabin fever to the max. But because he is a child, right, and because I'm a healthcare worker, I have to be super duper vigilant about making sure that he's staying in the house and that his hygiene and all that stuff is up to par, so on and so forth. See my previous video, I talked about hygiene and how to combat the COVID virus. That will, guys, help you guys on that regard. But this is not a game, you guys. I'm not making this video to scare anybody. I want to keep everybody up and on the up and up and on the positive. But this is not a game, right? We are dealing with something serious. These patients that have other comorbidities, diabetes, hypertension, especially other type of respiratory distress stuff, these patients are having a very, 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 very hard time with the COVID-19 virus. And I just don't think that a lot of people are taking it as serious as they should. Even some of these Congress peoples and these governors, I don't think that they're doing what they should do. I don't think that they're doing what they're supposed to do. So I'm just reinforcing what you guys have already heard over and over again. Look at Italy. Understand, as the United States, you can look this up on the CDC website. We have surpassed the amount of positive COVID-19 patients than China, right? Didn't we think that it came from China, Wuhan, China, right? That was our initially what we were thinking. We have surpassed China in the amount of COVID-19 patients we have, right? That's serious, right? Because supposedly China had caught on to it a month before we had even got wind of it here. This is just hearsay. I'm not for sure. So I'm telling you guys that to say that this is not to be played with or joked with. Stay home. Find some things for you and your family to do inside the house that can kind of keep you guys busy. But if you can stay home, stay home. This is not a game, you guys. It's a serious business. Again, this is 𝗛𝗲 So Awesome. I want you guys to be well. I want you guys to and also, I want to get rid of some of these rumors out here that people are saying, like, it's only old people. That's a lie. Right? My patient I had the other day that was diagnosed with COVID-19 was 31 years old. Okay? So it's not that they are just old people. That's not true, right? There's young people too. There's also some confirmed child cases in Atlanta. So it's not just about age, right? They're not just old people anymore. That's a lie. Then I heard there's a myth that it's just old people that are dying. That's a lie. It's not just old people. It is young people as well. It is healthcare providers. It is everybody. Then I heard that you have to have like something else going on, like another type, like a comorbidity. Those are the only people that are dying. The people that have comorbidities, and that's not true, right? There are some cases of people who don't have comorbidities that we are aware of that are passing away as well. So I'm here to tell you guys that this is serious. This is not to be played with. This is not a joke. You've got to stay up to date on things. If you're concerned or want to know more about the COVID-19 virus, I would refer you to the CDC. They have maps. You can see where certain parts of the world are being affected more than others. They can give you some things that you can do to kind of decrease and to minimize your risk for the COVID-19 virus. I encourage you guys to check on your family from a distance, phone calls, FaceTimes, stuff like that. I encourage you guys to be well, stay be very hygiene savvy, right? Washing your hands, sanitizing your hands. Make sure that you guys are on top of things. Make sure that you are taking the recommendations from these medical doctors and directors. I know there's been some conflict between what the president says and what these medical doctors are saying. And I'm going to tell you, as a nurse with a master's degree, you always go with the person that has been educated to the utmost on these things. When these medical directors are speaking, they are the ones with the education and the schooling, and these epidemiologists that are having these conversations and having these radio talk shows and stuff like that. Those are the recommendations you want to follow because they've done all the research that they can do and they've had all the training and all the schooling. The president is not being very I don't think that the government is taking it serious enough. And these medical directors and these epidemiologists and these doctors and these providers are very, very, very serious. They have a lot of compassion and they're very concerned. So please, please, please take their recommendation. It's 𝗛𝗲 So Awesome. It's good to see you guys. I'm so happy you guys have been liking, sharing, and reposting my videos. I appreciate you guys for all the help that you guys are doing with my YouTube page. And I shall talk to you later. Be well.